There are a number of bacteria belonging to a related kind of cluster. They are all gram-negative, rod-shaped bacteria. They're listed here in this table, and some of them are described a little bit more in your textbook. The genus that I'm going to focus on is Haemophilus, but again, some of these other organisms do cause disease in humans. They are not nearly as common as Haemophilus is. So, unfortunately, just in a semester, I can't cover every single organism that's in the book. So I've chosen to focus on the genus Haemophilus instead. Haemophilus is found on mucous membranes. So there are different species that you can find on mucous membranes all over the body. They require hemin and NAD for growth in vitro, meaning for culturing suspected Haemophilus, you would want to use chocolate agar. Again, chocolate agar, not chocolate, cooked blood. The species that we are most concerned with causing disease in humans is Haemophilus influenza. It has the name influenza because it causes symptoms of disease that look a lot like influenza, but it is not. Remember, influenza is caused by a virus, the influenza virus. Haemophilus influenza is a bacterium. It has a polysaccharide capsule, and there are 6 different serotypes. So basically 6 different profiles of this bacterium. Type B, Haemophilus influenza type B, is the type that is implicated in the vast majority of invasive infections. So type B is the serotype most associated with significant disease. Unencapsulated Haemophilus influenza and Haemophilus parainfluenza are fairly normal residents of the normal microbiome. They colonize the respiratory tract early in life. If given the opportunity, they can cause middle ear infections, sinus infections, and infections in the lower respiratory tract. But they are not super common causes of disease, especially in the lower respiratory tract. Encapsulated Haemophilus influenza are common causes of severe disease in unvaccinated children. Again, as a clinician, there are things that you have to be cognizant of and compassionate towards, even if you don't understand it or don't agree with it. The vaccination status of children is one of those things. You want to do the best job you can to encourage your patients to fully vaccinate their children. There are a lot of scare tactics that go into making people anti-vax, but it is your job, again, to be compassionate towards those parents who are worried for their children, but also to be firm and to have the knowledge provided by this class and other classes throughout your training that vaccines don't lead to those complications that they're worried about. And in fact, the diseases that children might get are far worse than any potential vaccine complication. So in unvaccinated children, encapsulated Haemophilus influenza can cause very severe disease. That can include meningitis. What you'll often see in Haemophilus influenza meningitis is a 1 to 3 day history of an upper respiratory tract infection before the child develops symptoms of meningitis. Again, stiff neck, fever. Those are the things that you're looking for when you're thinking about meningitis. Sensitivity to light. Even with treatment, mortality is approximately 10%. So if you suspect bacterial meningitis, you'll do a tap of the cerebrospinal fluid. To diagnose Haemophilus influenza, you're looking for a gram-negative rod-shaped bacterium found in the cerebrospinal fluid. So remember, it is important to know the gram status and the shape of some of these really common organisms. Haemophilus influenza can also cause epiglottitis. So it can cause cellulitis, basically a tissue infection in the epiglottis, which can cause swelling of the epiglottis, which can block the airway and lead to respiratory failure in the patient. So here what they're showing is a normal epiglottis. Here you can see it is very, very inflamed, and this is a tube. In your pediatric patients, the only way to prevent blockage of the airway is intubation. In a patient with severe epiglottitis, you often only get one chance to intubate. If you miss, the epiglottis can swell even more and shut off before you have the opportunity to intubate again. So you have to be practiced at intubation, and you have to be accurate when you do it. So be very, very careful if you have a patient who has developed epiglottitis. It can also cause cellulitis, right? This not skin level, but just a little bit deeper infection in the dermis. And it can cause arthritis, usually in a single large joint. And again, these are often manifestations we would see in children. However, Haemophilus influenza can cause disease in adults. Here's an example. A 61-year-old woman with pneumonia caused by Haemophilus influenza, this time type D. Now, type D is not as commonly associated with significant or severe disease. However, this patient has a long history of smoking, chronic obstructive lung disease, something like COPD, diabetes, and congestive heart failure. This is the patient that you probably are going to be really frustrated with because you're diabetic, you have COPD, you have heart failure, and you're still smoking. But again, be nice to your patients, do the best you can. She presented with upper lobe pneumonia in the left lobe of the lung. She had a purulent sputum, so full of crap, and what they found in there were many gram-negative coccobacilli. So they're not going to be super, super long rods. They're going to be a little bit shorter rods that are kind of in between that coccus shape and the long bacillus. Both the sputum and the blood were positive for Haemophilus influenza type D. The organism was susceptible to ampicillin, to which the patient responded. This case illustrates the susceptibility of patients with chronic underlying pulmonary disease to infections with non-type B Haemophilus influenza. So again, when you have patients who have chronic lung disease, who are diabetic, you see these higher risks for infection. They have a lot of adhesins that help them to colonize. They are trying to get into these mucous membranes. And really, the entire purpose of a mucous membrane is to stop stuff from getting in. So they have to be able to really adhere to these tissues to cause disease. Their cell wall components can damage the epithelium, which allows bacteria to move into the bloodstream, causing disseminated disease. The capsule in all of our encapsulated strains is antiphagocytic, which allows persistence. It prevents immune clearance. And because they are gram-negative, they do have LPS, they have endotoxin or lipid A, and that can induce inflammation as well. So this is maybe not a bacterium that a lot of people have heard of, but it does cause significant disease. They also have IgA proteases to interfere with humoral immunity. Remember, IgA is that secretory antibody that's going to be found in the mucous membranes, right, in your secretions. And so this bacterium is able to degrade the very antibodies that are supposed to protect you and prevent it from getting into your body. Before vaccination, there were over 20,000 Haemophilus influenza type B cases in children. And again, this is the most severe form of disease. This is the one that can cause meningitis and be fatal in children. After vaccination, there were only 33 cases in 2017. Worldwide, approximately 3 million cases, 700,000 deaths. That's a really high mortality rate. That's hovering just under 25%. Now, the vaccine is only against Haemophilus influenza type B. It's sometimes called the HIB or HIB vaccine. So now that we have a vaccine against the most dangerous type of Haemophilus influenza, we're seeing really low caseloads of Haemophilus influenza type B. Instead, we're seeing more commonly some of the other strains show up, not nearly to that same number. And we're also seeing non-Haemophilus influenza infections, so maybe Haemophilus parainfluenza, for example. Again, those other strains, those non-Haemophilus influenza infections, are not as severe as Haemophilus influenza type B. Here are a couple of other species that can cause disease. There's a particular species, Aegyptus, that's more highly associated with conjunctivitis or like an eye infection. There is a sexually transmitted infection associated with genital ulcers. And again, type B, Haemophilus influenza type B, was an important cause of disease in the U.S. prior to the development of the vaccine. The bacterium is not super fastidious. It's fairly easy to isolate in culture as long as you've chosen the appropriate medium. Remember, you have to provide that hemin and the NAD, so chocolate agar or other supplemented media. Gram stain of the cerebrospinal fluid can be diagnostic. Remember, gram-negative bacillus or short bacillus. So we've talked about gram-positive coccus, Streptococcus pneumoniae, gram-negative coccus, the Neisseria meningitis. Now we have a gram-negative bacillus or coccobacillus, Haemophilus influenza. So sometimes just a simple test can be the most rapid way to diagnose an infection. So this is why we ask you to do these things in the lab. These are not meaningless tests. Any sort of molecular test would take you longer than a gram stain of the cerebrospinal fluid. There is no molecular test that's faster than a 5-minute gram stain. So being able to do a gram stain accurately is a hugely important skill for clinical lab scientists. You can also do antigen detection of the polysaccharide capsule, and that can help you differentiate between the different types of Haemophilus infection, so type B versus type D, for example. Untreated meningitis or epiglottitis has mortality of about 100%. So these are not infections that you want to leave untreated. We don't see a ton of antibiotic resistance, so cephalosporins, amoxicillin, erythromycin are useful in clearing Haemophilus infection. We do have a vaccine available against Haemophilus influenza type B. On a vaccine list, you'll see it as HIB. That is going to be the Haemophilus influenza type B vaccination, and that will protect your patients against the most serious forms of the disease.